Welcome to Pet Week on Capitol Hill, where we connect the science of pet well-being to policies that make a difference for pets and people alike. I am Clodovita, your Pet Week host, and over the 15 years I've been in the pet industry, I'm constantly inspired by the innovations and ideas that help us better understand the impact pets have on our lives. For those of you tuning in for the first time, Pet Week on Capitol Hill is a series of virtual programming geared towards celebrating the importance of pets in our lives for our collective health and well-being. And that includes advancing policies that help meet the needs of pets and the people that love them. Pet Week is hosted by the Human Animal Bond Research Institute, HABRI, a nonprofit research and education organization that works to advance the vital role of the human-animal bond in the health and well-being of people, pets, cultures, and communities. Our programming this week will feature members of Congress, industry leaders, the veterinary community, animal welfare advocates, and research organizations, all coming together to share information about the importance of pet ownership in America and the scientific evidence that shows how policies that strengthen the human-animal bond can improve well-being for both people and companion animals. This session is brought to you by Boehringer Ingelheim and the Pet Industry Distributors Association. I'm pleased to be joined by two experts in the fields of human-animal interaction and social work for a discussion about their work to better understand the challenges cancer survivors face in providing for their pets' present and future care needs. Let's welcome them. Dr. Lori Kogan is a professor of clinical sciences for the College of Veterinary Medicine and Biomedical Sciences at Colorado State University. She is the chair of the Human-Animal Interaction section of the American Psychological Association and editor of the Human-Animal Interaction Journal. And we have Dr. Jen Currin-McCulloch, who is an associate professor at the School of Social Work at Colorado State University, a PhD program director, and lab director of the Serious End-of-Life Narratives Research Lab. Her research focuses on understanding the journeys of those who've experienced a significant health or relational loss and factors that promote existential well-being during their grief integration. We are so excited to have you both and to learn more about your research and its impact.
Thank you, Chloe, and Habri for having us this week. We're excited to be here.
Thank you, Chloe. And it is wonderful to be here. And we are super excited to talk today about our research. And so let's go ahead and get started. So one of the things that we are really excited about is the fact that we feel like that this research encompasses so many people's lives. And that's really because we're talking about cancer, which really has impacted all of us in some aspect or another, and pets. And so when we look at cancer, we have the fact that really it's so commonplace, right? So we have 2 million new cancer cases that have been diagnosed in 2024, for example. And that means there's about 5,500 daily diagnoses, and it's the second leading cause of death in the United States. And the most common types of cancer are breast, prostate, lung, and colorectal. And we know that folks with cancer tend to have higher anxiety and depression rates than the general population. We also know that almost all of these people that have cancer also have pets. So we know that about 70% of people in the United States have at least one pet in their home, and that almost all of us view pets as part of our family. We know that they offer an incredible array of benefits. So they offer things like increased well-being, reduced stress, less depression, less anxiety. But what happens when pet owners get cancer? And that was really the impetus of this study. And we realize that there's quite a bit of research that has been done on how cancer affects parents and the relationship that parents have with their children. But there really wasn't very much research at all about how when someone gets cancer, how does that affect their relationship with their pet? And we realized also that cancer survivors' concerns and guilt regarding their pets and regarding different changes that happen because of their cancer is often overlooked. and it's overlooked by everybody, right? So what I mean is that oncology healthcare teams, they often don't ask people about pets in their home. And we know that veterinary teams typically do not ask their clients about their own personal health issues. And so, really, nobody is addressing this important relationship and how it might impact or be impacted by cancer. And so that's what led to our study. And through the generosity of Habry, we were able to do a study looking at 930 cancer survivors with pets. And we included survivors from each of the four most common types of cancer. And the assessment that we did, we looked at both quantitative and qualitative assessments. And so for the quantitative, we had an online anonymous survey. And then we looked at things like pet attachment, concerns related to their pet as cancer impacts that relationship, the guilt that survivors have regarding changes with their pet, what kind of support that they have and support that they need, and then how some of these different things affect their quality of life. We also looked at qualitative data. So we wanted to get that deeper understanding that sometimes qualitative data can provide for us. And so getting a better understanding of both the benefits that pets provide during such a challenging time in people's lives, and also the challenges that come up in people trying to maintain that relationship with their pet. And so the qualitative analysis was responses to the open-ended questions that we had included in our survey. And then we also conducted focus groups. And so I'm going to talk a little bit about the findings, and then I'm going to pass things over to Jen, and she's going to continue. But for findings, one of the things I wanted to start with were the benefits that we found that survivors talked about with their pets. And these really fell into kind of these four large categories of benefits. And the first one was emotional support and just that comfort that people have from their pets during such a difficult time, that unconditional love, that feeling that we have that our pets don't care if we've lost all of our hair or what we look like or if we got dressed today, right? Our pets don't care. Also, that social support, that companionship that pets provide, and that reduction in that feeling of isolation. A lot of times people are spending a tremendous amount of times in their home, right? And so reducing that sense of isolation. Affectionate support was another category, and that's that idea of that physical contact, that physical touch that we get from our pets, and sometimes that's really lacking from other humans, but available to us through our pets. And then lastly, the tangible support. And what we meant by that is that motivation to get out of bed in the morning, that idea that your pet is relying on you to walk them or to feed them or to take care of them, and that motivation and that sense of purpose that comes from that. So we also found that those that reported strong bonds with their pets felt more support, which absolutely makes sense, right? But then those people also reported feeling more guilt related to changes that had happened in the relationship with their pet as a result of cancer. And we found the strongest bonds reported by women, by younger survivors, and then those survivors that did not have young children. And I wanted to include a couple quotes as we go through some of our results of our study so that you can get a sense from actual survivors on their perceptions. And so for benefits, this says, my pet has been my biggest source of comfort. During the toughest times when I felt weak or down, it would lie next to me, offering a kind of emotional support that words can't describe. Their presence reminded me I wasn't alone, and their affection helped me keep going even when I was feeling my worst. Another survivor said, during my hardest moments of my treatment, my pet was a lifeline. On days when I felt completely drained or overwhelmed by everything I was going through, they would simply be there offering comfort without expectations. Their presence brought a sense of normalcy, and just petting them or having them curl up next to me helped to ease my anxiety and provide a moment of peace. Their need for routine also helped push me through, as I couldn't afford to ignore their care, and that small sense of responsibility kept me going. There were times when their goofy antics or affectionate nuzzles made me laugh when I thought I couldn't anymore. My pet reminded me that even in the midst of pain, there was still love and companionship to be found. Another aspect that we found in our results were pet related concerns. And so we have all of these benefits that come with pets, but then we also had survivors talk about concerns that they had. And one bucket of these concerns were practical concerns and the physical limitations that many survivors have during treatment and recovery that makes just basic pet care difficult. And so sometimes it's that amount of time that they need to spend away from home because of treatments, because of medical appointments. A lot of dog behaviors can be really challenging, jumping up on surgery wounds, for example, or being too rambunctious. Dog walking can be really challenging as well because maybe somebody's exhausted. Also, some dogs are not the best on leashes and pull on a leash when we're walking them, and that can be really difficult for survivors. Lifting dog food or lifting kitty litter can all of a sudden be super challenging. And as well, cleaning up accidents around the house and bathing, all these things that take amount of energy that usually we take for granted can be really challenging for survivors. And so one survivor talked about right now, my biggest worry is making sure that my pet gets the care they need while I'm dealing with cancer. There are days when I'm too exhausted to even get out of bed, and I feel guilty that I'm not able to walk or play with them like I used to. The routine they're used to is slipping, and that weighs on me. Another aspect of challenges that we discovered in our research was those related to emotional challenges and the impact they felt like that cancer and then all of the things that happened because of cancer had on their pets. And so a substantial portion of participants reported things like feeling that their pet really worried about them or that their pet was emotionally upset by their illness or seemed confused and that they thought that their pet's mental health was struggling as well, as they tended to try to cope with some of the changes that are occurring. And then another bucket of concerns related to the concern if they were unable to continue caring for their pet. And so a substantial portion of our participants talked about feeling very concerned that there would be no one available to take care of their pet if they were to die, and that they didn't have somebody that was available that they could call on, and that the concern that they had about then what would happen with their pet. And so one survivor said, looking ahead, I'm scared about what would happen to my pet if my health declines further. I worry that I wouldn't be able to give them the care they need, and the thought of having to rehome them is heartbreaking. I just want to make sure they're safe and loved no matter what happens to me. And another survivor said, my biggest worry for my pet is whether I'll be able to take care of them as I want. If my health gets worse, I'm concerned I won't have the energy to give them the love and the attention that they need. And I worry about who would step in to care for them if I can't. It's hard to imagine them feeling confused or neglected during this tough time. And at this point, I'm going to turn things over to Jen, and she's going to continue by talking a little bit about guilt.
Thank you, Lori. I'd like to build on the last quotes that you were reading, thinking about the unpredictability of cancer and cancer treatment and how that makes it really hard to know from day to day how much energy you will have or how you will feel. And so guilt comes up as a result, a lot of this uncertainty and overwhelm. So many pet owners said that they felt guilt due to the changes in their previous level of care and attention they're able to provide for their pet. So, this guilt was really strongly correlated with decreased quality of life for the cancer survivors. They felt torn because oftentimes, due to finances and time, they ended up having to prioritize their own healthcare needs over their pets' needs. And because of this, they felt that they're failing as a pet parent. They weren't able to be the same kind of love to their annual animal that they were in the past. And so we found this is very similar to parents and the guilt that they feel for their children and their change of care when they, as a parent, are going through cancer. Within all of this data, we found there are certain groups that are more risk to have guilt. Those who are newly diagnosed and probably more time away from home and having more symptoms. Those who are under age of 30, and those who had strong bonds with their pets. And so here's in the words of a survivor, what guilt looked like for them. I'm worried about failing my pet. I'm so tired all of the time, and it breaks my heart when I can't find the energy to walk them or play like I used to. I watch them look at me, confused and anxious, and I feel this overwhelming guilt. I can't keep up with their needs, and I'm terrified they're feeling neglected. The financial burden is suffocating, and I don't know how to balance my treatment with caring for them. Every day feels like I'm slipping further away from being the pet owner they deserve. And so in this table here, I can summarize it for you in that we're looking at what guilt can look like for survivors and what causes this guilt. So this is due to their change in energy level, having to prioritize their needs over their pet's needs, not having enough time to have that quality time with their pet that they used to have and to work on that bond. They're worried they're not able to provide for their pets because of the financial burden that cancer can place, or what we often call financial toxicity of cancer and its treatment. They worry their pet is not getting enough love and attention because of their treatment. And lastly, they worry they're not being as good a guardian as they were before, just because of their cancer. And so we also found, we asked them what it was like, where they're receiving their support from in terms of their medical and veterinary team. So that would be their oncologist and other medical providers. So that could be their nurses, their social workers, their physical therapists, as well as their veterinarian. And we're seeing trends across this table. On our far right, you'll see those with lung cancer and breast cancer were most likely to feel that they were not supported by their oncologist, medical providers, or their veterinarian. And this showed up in our quantitative data as well as in our qualitative data, including our focus groups. And so, what does this support look like? So, their support network has been a lifeline in so many ways while I've been dealing with cancer. My family and friends have taken on the day to day care for my pet, from walking her to making sure she gets fed and has fresh water. They've been there to give her the love and attention she needs, especially when I've been exhausted or too sick to do it myself. My vet has been incredible, offering advice on how to manage my pet's stress and health while I'm going through treatment. They've also been flexible with appointment times to make sure I don't have to worry about getting there when I'm feeling unwell. I've had a few friends volunteer to bring my pet to her vet visits when I couldn't make it, which has been a huge relief. Overall, it's the small, thoughtful acts, like offering to spend time with her or stepping in when I can't, that have allowed me to focus on my recovery, knowing my pet is well cared for. And as you can see, this is an exemplar case of someone who has a supportive team all around. So I want to provide a summary for you. So of our 930 cancer survivors with breast, lung, prostate, and colorectal cancer, again, the four most common types of cancer in the US, our highest risk groups for pet-related stress are those who are under 30. They're reporting more guilt and concerns. Those who are more recently diagnosed within the last 2 months. So really, it's just this time period where they're trying to figure out who they are, what their day looks like, and the scariness of what the unknowns are ahead. Those with the strongest pet bonds, paradoxically, experience the most guilt. Those that are most closest felt the most guilt. So, survivors with children under 5 are managing so much at home, as you can imagine. So, any less attention from one loved being in the home increases that level of guilt. And those who are single or unmarried often were carrying on their own and had less support to help them. So, for our healthcare teams, we really want, if you are one of these folks or you are going to your healthcare team, think about how important it is for your team to know that pets are a member of your family. When you are supporting folks as a healthcare team member, anyone across the team, just ask. How are your pets? Do you have pets? How has your relationships changed? How has your relationship changed with your pets? So during treatment, things change. We know more side effects can happen. And so ask about their pet related stress, provide resources, and address safety concerns such as chemotherapy, radiation, or zoonotic, or these illnesses we can pick up from animals. So for families and friends, I think the most important thing is to be there to ask again, ask questions. How is your pet? How are you doing? How are they doing? So caring for them, caring for your pet means that you are caring for them. Practical things you can do: take their pet for a walk, empty the litter box, very important for folks that have low immune systems. Offer to take their pet to the vet, or pick up supplies like the heavy 50-pound bags of litter or dog food, and be there for emotional support. Validate the feelings that they're having of anxiety and guilt. Support them with backup plans. Can I help take your pet? Can I empty the litter box for you today? Can I bring food while you're over at chemo or in the hospital? And what can we do to help reduce guilt as family and friends? It's very important. For our veterinary teams, there's some red flags that you can look out for during appointments, like missing appointments or coming late. Maybe if the pet is showing up and their fur is a little bit more messy than usual, or their nails are longer than usual. If the owner seems a little more overwhelmed or emotional, also look at changes in their pet's routine or their behavior. If the owner is telling you that maybe they're having more clingy behaviors or more barking, things like that. So communication strategies, we thought we'd share a couple pointers for you, questions you could ask to start a dialogue or comments. I know caring for your pet during treatment is difficult, so just acknowledging this challenge. Validating their efforts. You're doing the best you can right now. We recognize this is hard. This is hard for anyone. Offering specific help. What can I do to help? Can I help you to shift your appointment so you could have a morning appointment if your radiation appointment is in the afternoon? And normalizing their struggles, such as I've had several clients go through something similar when they've had an illness or when they've had cancer. So I'd like to share a couple key takeaways with you. I want you to remember, as you probably have heard from us, that pets are family members, and they're a very essential part of cancer survivors' healing and recovery process. Pet bonds provide support and comfort and love, companionship. But also during this process, stress comes about in trying to be the best pet parent they can be, and having cancer present barriers that makes that impossible for many. So oftentimes, pet related guilt brings about a lower quality of life. This anxiety and stress as well reduce the quality of life for cancer survivors. So, this is where we can jump in to help as medical professionals, as policymakers, as family, as friends, to support and help to maintain that bond. So, caring for our pets is caring for our survivors and also creating better survivor outcomes and better quality of life for our pets as well. So, in conclusion, our pet related concerns and guilt significantly impact a cancer survivor's quality of life. We encourage you to help support the human animal bond, and this supports the whole family's healing process. And small acknowledgments, asking how we can help, or telling a story about how great their pet is, can make a huge difference in reducing a survivor's guilt and stress.
Thank you so much for all of that information, Dr. Kogan and Dr. Currin-McCulloch. That was really, I was feeling emotional. So I imagine everybody, because cancer has touched so many of us, we're feeling the emotions of that. One of the things you said, I just have to bring up before we get into the Q&A here, Dr. Currin-McCulloch, is you said, and I quote, caring for their pet means you are caring for them. And that really hit home for me. I just found it to be like, oh, heart full, heart sad, heart happy. All of the heart things happened there. And when we look back at everything you just shared, what is for you one of the more surprising or impactful things you learned during all of your focus groups with all of these cancer survivors?
Yes, thank you, Chloe. It is very emotional reading through it and sitting with folks in focus groups. and reading their quotes that they share in the survey,
Mhm.
it brings back a lot for me for being an oncology social worker. And what really stood out to me, and in particular in the focus groups, was that they were shocked when Laurie and I asked about if they had had anyone from their medical team talk to them about their illness. And so they thought, well, why would they? And so for us, it was really important to bring up the point like they should be asking
Mhm.
about your health and talking with you about the pet that is a significant being and presence in your life. So they felt that their oncologists weren't asking about it. Their veterinarians weren't asking about it. So they didn't know what to do. And so they were very isolated in their experiences. They also felt a large sense of isolation from the people that they trusted and thought would be for them and their families, their friends. And so it's a sense of the one who I thought would be here the most, my mother. I thought she would be here, but she's not. My daughter works in the healthcare system. She has not come to my house once to check on me or my pet. And so there's a lot of disappointment, a lot of hurt feelings, a lot of isolation. And so from the focus group again, I think a lot of people said, just ask, what do I need? Ask me about my pet. Tell me about something going on in their life or something silly they did. Show me some cat videos. Just make sure I know that my pet is important to you like they are to me.
Oh, that I resonate so much with everything you just said because when you mentioned the whole it made me think of siloing, right? Is that we go to our health doctor, we go to our veterinarian, and we're not recognizing how they're all interconnected, especially when you're dealing with something like cancer. So thank you for that. That is surprising and amazing, and I can't wait for more of this research and all of this information to get out in the world. And with that, Dr. Kogan, when it comes to what we want our members of Congress to know, what we want Capitol Hill to be thinking about, what here is do you want to leave them with? What should they know?
Thanks, Chloe. I think what we want them to know is how commonplace this is, right? I mean, we cancer is so commonplace, and we know that almost all homes have pets. Yet this has been a topic that has been traditionally ignored, and so having more focus on this and recognizing that caring for the person means caring for all of them and their family. This whole concept of one health, right? It's not just one person's physical health, but it means their emotional and physical and spiritual health of them and all of those around them, right? And so really hoping that Congress starts to see the importance of this relationship and the importance of pets within family, and maybe move towards supporting policies that might be some type of a healthcare integration. And so maybe it's some type of tax benefits for caring for pets during illnesses, or maybe it's some type of other types of financial assistance. Maybe it's really working towards increased fair housing regulations, since we know that that's a struggle for so many people. But this concept of really starting to pay attention to the commonplace of this problem and starting to address it on that level would be so valuable.
Hmm. Well, this is the week to get this out there. This is the week to really connect and bring all of this information, this research, the policies to the forefront. And with that, I'm sure there are many people here who are interested in your work, who want to know more, who are looking for how do we stay connected? How do we keep ensuring we're educating ourselves on this? So what would you both like to leave people with here and where can they learn more about you? We'll start with you, Dr. Currin-McCulloch.
Great. Thanks, Chloe. We would love for people to engage with what we're learning. Lori and I feel a strong sense of the work that we do. We want it to be at the bedside. We want it to be in the home to support people, not just simply the publications we have, which, yes, you can find if you want to nerd out or need some facts for your policy statements or white papers you're doing. But we are building a website that is available for anyone to come to. We have a pet resource guide that we're going to create. And I'll let Lori talk to you about our visions for our next steps for coming into cancer centers and helping.
Thanks, Jen. That is our vision, is that there's definitely an applied focus to this research in that we want to make things different for survivors, and we want to make things different and easier for oncology professionals to have these types of conversations. And so we're working now on creating tools to help make sure that that happens. And so we're working on a pilot study to look at, okay, how do we implement these tools that would be most helpful based upon the research that we've done that shows where folks need the most help. And so that's what we're really excited about for next steps. But just one other thought is that anybody listening to this can maybe think about the people in their life. And the next time you interact with somebody that has cancer, maybe this will be one of the things that you think about. And you can ask specifically, how can I help you with Fluffy? Can I pick up some food for you? Can I take Fluffy to the vet for you? If all of us did just those one or two things, we would make a difference in the world.
Oh, I think we all want to make a difference in the world, so we will take that with us. And thank you, Dr. Kogan and Dr. Currin-McCulloch, for your time today. It was such a pleasure to learn more about your research and how we can better support cancer survivors through helping them meet their pets' care needs. So important in the world today. Thank you both.
Thank you.
Thank you.
Thank you again to our session sponsors, Boehringer Ingelheim and the Pet Industry Distributors Association, and for all their work they do to help strengthen the human-animal bond and the science behind it. And thanks to all of our Pet Week sponsors who are dedicated to sharing information about the importance of pets and the human-animal bond for people and communities across America. Don't forget, Pet Week sessions continue throughout the week. Be sure to visit petnight.com or Habry's Facebook page to add sessions to your calendar and tune in. On behalf of Habry and all of our sponsors, thank you for joining us, and we look forward to seeing you again.